We're here to talk to you today a little bit about behavioral health and the older adults. We know that you have volunteered for the Buddy program, and we just want to give you some behavioral health information that might be useful to you as you begin to work with your buddy.
The training objectives for today include increasing your knowledge base about depression, substance abuse, and suicide in the older adult. We're also going to take a look at risk factors and signs of behavioral health issues that we may see in older adults. We would like you to become a little more comfortable with having potentially difficult conversations with some of the buddies that you may encounter with a behavioral health issue. And then finally, we want to leave you with some resources that may be important for you to be able to access when working with your buddy that has behavioral health issues.
So why should we even talk about this? We know that behavioral health really encompasses both mental health issues and substance abuse issues. So when we use that term, that's what we're referring to. And really, in meeting with these folks that you're going to be paired with, you're really the front lines. So you may notice things before anybody else really sees them. In being that first person to notice, we want you to not feel like you're expected to solve the problem or do something about it, but to bring the concern to the buddy coordinator and just bring the issue to light so that the person can get some assistance.
And we know that mental illness in the elderly is often overlooked, and it can be difficult to diagnose for a variety of issues. But what we really want to take a look at is the fact that mental health concerns, substance abuse concerns in the older population can really diminish a senior's health and well-being, and it also can make it more difficult to treat chronic health conditions and may indeed even lead to premature death. Some of the triggers that may precipitate a mental health issue in a senior can be something as straightforward as chronic pain. It could be associated with a chronic disease process. There could be physical impairments such as thyroid, adrenal disease, etc. All of those things could impact someone's emotion, thought, and memory. The older adult frequently experiences physical disabilities, loneliness, and major life types of changes. They also experience a lot of grief. There can be things like widowhood, for example. There are certain medications that can cause an increase in symptoms. There is sometimes malnutrition and a poor diet. An older person could have heavy alcohol consumption and or drug abuse. And then finally, there are things that are associated with dementia or Alzheimer's disease. 4 common behavioral health issues that we're going to touch base on today are depression, anxiety, alcohol use, and prescription drug abuse. So when we look at depression in the elderly, there's a couple of statistics we want to bring to your attention. There's an estimated 20% of folks 55 and age older have some type of mental health concern, which means that we have about 6 million people, or 1 out of 6 patients in a medical practice that may be having this experience. And depression in this population affects up to 5% of the folks that are older and jumps to 13.5% for those that are requiring some type of home health care. And then when we look at the depression across gender, we know that men that are age 75 years and older have a higher suicide rate than any other age group, 38 per 100,000 in our population. And we want you to be aware of some of the symptoms of depression. And again, as we're going through all of these, We will continue to reiterate that we do not expect you to provide any treatment for these items. We just want you to be aware of them so that you can reach out to your buddy, say you're noticing some things, and be able to bring it up to the coordinator of the program. So some possible symptoms of depression include a marked change in appetite, energy level, or mood, emotionally feeling flat or really lacking having any emotions at all, having difficulty sleeping too much, having difficulty falling asleep, having difficulty staying asleep, and very persistent thoughts of hopelessness, sadness, and perhaps even suicidal thoughts. And then a desire or almost a need for alcohol or drugs. Several people will indicate that they feel on edge, restless, have difficulty concentrating. They will have increased feelings of stress or worry. They'll have memory loss, both short-term and long-term. And they may have feelings of anger, become agitated, maybe even aggressive or an increase in aggressiveness. And they may have unusual behaviors or thoughts that they direct towards others. Then we start looking at the mind-body connection, and we know folks with depression will have physical health concerns as well. They may have digestive issues. They may have an increase in pain. They may have an increase in the frequency of pain, headaches, things such as that in the physical health areas that really are not explainable with a physical health diagnosis. They may have difficulty managing their finances or other tasks that involve numbers. They may have problems with some of their grooming or household maintenance. And they may experience so much pain that it creates that hopelessness and helplessness, and it may progress to the point where they just don't want to continue on. So when we look at what that consists of when folks don't want to move forward, when they perhaps don't want to wake up the next morning, there are some things that we know that put the older adult more at risk, or really all people more at risk. And the first thing is a family history of someone dying by suicide. We know that can increase your risk factor by a six-fold increase. We also know that a significant loss recently may increase a person's risk factor. And most people will think of a death when we say a loss, but it can be any type of a loss. It could be something like a separation, a divorce, moving, breaking up with a boyfriend, girlfriend, when somebody decides to retire and they no longer identify with their profession. We also know that the ratio of suicide attempts to suicide death in youth is 25-1, meaning that a youth may attempt suicide 25 times, one time that will result in death, but that skyrockets with the older population. It actually culminates in 4 attempts to 1 death. So what we know is when an older person decides to try to end their life, they're much more likely to have that attempt end in actual death.
Some of the verbal warning signs that one may hear when someone is experiencing depression or at risk potentially of attempting suicide, you may hear common statements like, I shouldn't be here, I feel like a burden, I'm going to run away, I'd like to go to sleep and not wake up, I wish I were dead, I'm going to kill myself, actually making the statement of intent to do that. I wish I could disappear forever. Asking if a person did this or did that, would he or she die? Inquiring about different methods. Saying maybe if I died, people would love me more. I want to see what it feels like to die, or my meds aren't helping anymore. Know that your caring is important. When you observe these signs of depression, addiction, or evidence of potential suicide in a person, it's important to share your concerns with a buddy director or the other resources that you'll see at the end of this presentation.
So we also want to speak a few minutes on what anxiety in the elderly look like. And they consist of potentially general feelings of not feeling well, poor health, again, having sleeping problems, COPD or certain other cardiovascular problems may increase your risk of experiencing anxiety. There can also be other physical health, chronic health concerns such as diabetes, thyroid disorder, etc. And then finally, there are sometimes side effects of prescribed medications that will also lead to some anxiety. And then, of course, the abuse or misuse of alcohol or even street drugs, and definitely even prescription medications. There can be physical impairments limiting daily functioning that can cause symptoms of anxiety. There can be stressful events as well, such as the death of a spouse, obviously, but also that serious health condition that we know that older folks can need to adjust to. There can also be general life-altering events. There's a lot of loss involved with becoming older. There's a loss of mobility, sometimes a loss of social relationships, etc. And those are all very large life-altering events. Then there could be a traumatic or difficult childhood that is emerging now and creating difficulties for the older adult with their anxiety. And then they can also have what we call a perseveration on physical symptoms, and that is just an over-concentration on what those physical symptoms are and whether or not they're going to improve, how to manage them, what the future holds, and that type of thing. All of that together can really increase a person's risk factor for having anxiety.
So some of the indicators of alcohol abuse, and the body really changes as a person gets older, so that's something really to consider, that the same amount of alcohol that a person used to drink before may not be tolerated as well as they age, and that could be due to medications that they're taking, due to just their metabolism changing, and things like that. So bear that in mind. If you see that the individual is using alcohol to forget their worries, calm down, to deal with some of those life changes that we talked about, that may be sort of a red flag that there might be some issues going on. If they start consuming more alcohol more often, if they're drinking more than one drink a day, it may be worth having a conversation with them. If they're harmful to themselves or to others while they're drinking, and that may include anger, it may include accidents, those would be red flags as well. Becoming irritable when not drinking. So if they are delayed in having their cocktail for the day, if they are not able to have their alcohol and they're irritable, that may speak to that they're experiencing some withdrawal symptoms, and that would definitely be a red flag. If they start experiencing problems related to their alcohol use, they don't have money for other things, they've started to maybe have legal problems, or people aren't wanting to hang around them like they used to. Those are some indicators as well. Prescription drug abuse is very common actually in older individuals, and that's for several different reasons. Often due to medical issues and compounding medical issues, more and more medications may be prescribed to legitimately manage these medical problems. Sometimes those chemicals interact with one another and can cause some ill effects. The other thing that can happen is a person can become addicted to different pain medications that they've been prescribed. Consider too that, as we mentioned, metabolism changes and the body may not be able to manage everything the same way it did before. Hearing and visual impairments may get in the way of really understanding instructions around medication or being able to read the bottles. So there may be some really unintentional misuse of medication. People may become forgetful and not remember whether they took their medication, and then either take too much or too little purely on accident. Unfortunately, we know that overdoses are happening in all age groups, including the elderly. So prescription drugs can be a significant issue. In addition, if someone is mixing alcohol with new medications, it could definitely cause a problem, could cause falls, could cause accidents, and could cause some significant medical issues as well.
So one of the general risk factors we know about, which are really significant, and again, probably a big part of why we looked at creating the Buddy project, is the concept of isolation. And this that you see on the screen here is just what we call an infographic that kind of explains different concepts. And this is one that you can take a look at that explains the concept of isolation. So what we know is that what I had indicated before, that the elderly have a lot of loss. And inherently with that loss, a lot of times it can lead to isolation. So if I used to go to work every day, if I used to be able to drive my car around, if I attended church on a regular basis, and those things began to be lost in my life because of chronic health conditions and maybe not being able to drive anymore, maybe a loss of some income, so poverty factors into it, I lost my spouse or partner, etc. Any of those things begin to create potentially a very isolating type of life. And so that's one of the reasons why we wanted to create this option and this resource for folks that do potentially feel very isolated, so that they know that there's somebody out there that cares about them. They know that there's going to be somebody out there that will call, that will stop by. And we know, as much as that's a very significant risk factor for depression, anxiety, suicidal thoughts, it's also just as strong of a protective factor. So we know if we can add that to an older person's life, it can be extremely helpful in allowing them to still feel connected to their outside world.
So who is at risk to experience these behavioral health issues that we're talking about? We know that no one is safe from the potential to experience these things. Age, wealth, education, family history, background, race, religion, it doesn't determine whether or not someone's going to have these issues. Those things aren't a safeguard. So again, this is why we're sharing this information, because the person that you're working with may be at risk for these symptoms as well. We also know a suicide is a desperate cry for help, and it speaks to overwhelming pain that the person is feeling. And again, to reiterate, it's not likely that the person that you're working with will engage in a suicide attempt, but we want you to know these risk factors, and to know that any of those red flags that we've mentioned are a desperate cry for help.
The next few slides, we want to talk about what we consider to be some common myths that are associated with reaching out to those with behavioral health issues, and individuals' willingness to get help if they're not feeling well. So the first myth is, if I get treatment, everyone's going to know that. So what we want to talk about with this myth is the fact that counselors, therapists, addiction counselors, all of these different psychiatrists, etc., they all are bound by confidentiality, which means we really cannot discuss other people's issues unless that individual gives us permission, wants us to do that. And we also have counseled them as far as sharing just the information that's necessary to get something taken care of.
Another myth is that an elderly person won't become addicted. If he or she had a problem, it would have shown itself, it would have surfaced when they were younger. And the reality is addiction can occur at any point in a person's life. As we mentioned before, sometimes due to losses or changes in a person's life, they may begin using substances more and become addicted later in life. The other thing is you may not know a person's entire history. They may have had trouble with a substance in their youth or earlier in their life, and then took care of that and were managing that piece, and it sort of sparked as a problem again later in life. So just know that just because you haven't known a person to have had a problem with a substance doesn't mean that they can't have a problem today.
The next myth, you can't help someone with mental illness. So again, I think that whether or not it's mental illness, whether or not it's addiction, a lot of times there is a misperception in the general community that both of these types of issues are not treated successfully very often at all. And what we need to remind folks of is that both are chronic health conditions. Both do indeed include relapses a lot of times, but so do a lot of other medical health issues, things such as diabetes and high blood pressure. As a matter of fact, what we know is addiction and mental illness can really be treated in many cases at a higher success rate than those other chronic health conditions. The important part is to notice if something is different in your body and to know how to reach out and to feel comfortable doing that.
A lot of times when an older individual is drinking or using substances, we may say, oh, his or her use isn't causing any problems. Let them enjoy their life at this point in their life. And the reality is a person's substance use can really impact the quality of a person's life and can cut short a person's life depending on the pattern of use. Lots of accidents can come as a result of use, illnesses, exacerbation of other problems that are going on. So it really impacts the quality of a person's life.
So now we want to talk a little bit about, we know what causes folks to be at risk for depression, anxiety, substance use, and misuse. We know what some of those signs and symptoms are, and now what we want to do is to talk about what can you do about that. And we're doing this really for two purposes. The first is to reiterate again, we're not expecting you to become counselors or therapists and to treat these individuals. We just want you to increase your comfort level at noticing something is maybe different than how your buddy was on your previous visit, and then really bringing that up to the coordinator so that outreach could be done by the professionals. So I think a lot of times folks feel that if it has to do with behavioral health, maybe I shouldn't ask about it, just as we don't ask about maybe politics or we don't ask about finances. But what we also want to reemphasize is that these are folks that are at risk of isolation. So if you're not noticing it, if you're not taking action, they may not encounter anybody else who's going to step forward and take action either. So all we're asking is, just like if you walked into your buddy's home and they were grabbing their chest, that situation, we don't expect you to do CPR. We don't, and not unless you're trained. We're not expecting you to do heart surgery. We are expecting you to go, you're grabbing your chest, maybe I should dial 911. So we're just talking about that level of, let me notice if something's different, let me ask about it, and let me reach out and get you help if you'll allow me to do that.
So what on earth can you do then? You can start to ask some questions. And a lot of times people are hesitant to ask questions because this can be an uncomfortable and sensitive topic. But know that asking questions is important, appreciated, and isn't going to cause more problems for the individual. You can say things like, you seem pretty down. Are you okay? Or, do things seem hopeless to you? Have you ever thought it would be easier to be dead? asking, have you ever considered suicide? Remember that asking someone if they've considered suicide or are considering suicide will not prompt them to start having those thoughts. It will not cause them to have those thoughts. If they're having those thoughts, they're already having them. And they'll likely be relieved that you're addressing it and upfront asking them about it.
Yeah, remember what we said before is that for the most part, an individual that's contemplating suicide or makes an attempt on their lives, they don't want to die. They don't want to end their life. Usually what they're really looking at is to end that excruciating pain they're in. So if you can open up that door and have those conversations and let them know it's okay to get help, that is enormously helpful.
Absolutely. And if you ask the question and they say yes, don't panic. Your goal is to ask a few more questions like the ones that I suggested, and then to contact Lorain County Public Health for someone involved in the Buddy Project, and they'll help guide you as far as what to do next.
We're going to give you an acronym. This may help you kind of keep a game plan in mind. And just as the general public has learned very well what CPR means, our acronym is QPR. And what this really stands for is to question a person if you're seeing something amiss, something different for that individual, and asking the question about suicide so that you're clear in your communication. And then P is to persuade them to talk and to get help. And then R is referring that person for the professional help. So again, in your situation, you can do these at the level where you're just noticing something, you're asking the buddy, it looks like things are a little bit different for you, you look this way or that way, the types of questions that Christine asked about, and that just asking them, is it okay if I contact the Buddy Project so that we could try to access a professional that can come out and talk with you and see if there's any help that you may need. So that hopefully will be a much more comfortable conversation for you to have. And then we'll pick up from there and do our jobs, which is a little bit more in-depth and actually getting the person to the next step as far as safety and health.
So we have just a few scenarios that we thought we'd share and kind of run through maybe some things to think about if this scenario were to play out. The first one, Mr. Smith has recently been told that he has kidney problems and will have to be on dialysis. His wife has dementia and their children all live out of state. The children have decided that Mrs. Smith needs to go to a nursing home because she started wandering. Mr. Smith tells you not to get old. He says that you just become a burden and you can't even take care of your loved ones that depend on you. So if you were to encounter Mr. Smith and this was sort of the circumstances, some of the things that might pop out of this scenario might be changes, those medical changes that we mentioned, isolation, that his children live out of state, he's not able to take care of his wife like he used to. So we'd be kind of concerned about these changes and the isolation.
Yeah, so you would just ask some questions to see if he would allow a professional to come in. When we look at the resources, you'll find out that Firelands is one of those resources. We can come out, we can meet with Mr. Smith. We could link them up with someone if the wife needs to go into a nursing home. We can coordinate with the children, etc. And really what we're looking at is not only taking care of those more imminent problems for Mr. Smith, but really taking a look at his own mental health and substance use and misuse if it exists there. So while we definitely would be taking a look at imminent safety issues, this may be something where we're going to come in and just do some resource linkage and get Mr. Smith in some treatment. The next scenario is Mr. Tate has lost his wife over a year ago. And a staff person has noticed that he continually talked about being lonely, not knowing what to do. He'd been a caregiver for his wife and did not have many other supports. He mostly sits around looking at TV and is often tearful. He appears to not be eating as much as he used to, and has recently, looks like he lost about 10 pounds in the past couple of months. And he really feels like he has failed his wife. So again, what we're taking a look at is that isolation. He lost his wife, that feeling of failure, which is connected with depression, which is connected to anxiety, about not being able to have cared for her correctly. We know that appetite changes are one of the signs and symptoms of depression. And that fatigue and that lack of physical movement is also a symptom. So we definitely would want to take a look at, does Mr. Tate need some counseling? Does he need some socialization? Does he need an evaluation for perhaps an antidepressant? So again, kind of a treatment, a referral for him.
The next scenario, Mrs. Jones has been more clumsy lately. You've noticed that her medications are not as organized as in the past. One day she's slurring her words when you visit, but she says she's feeling fine. She was not dressed as well as usual, and the place was a mess. So here we're noticing some definite changes from one visit to the next. You're seeing that her medications aren't organized, so that's kind of a red flag that something might be going on with the medications. Her slurring could be a result of many things. She could simply be tired that day, but it could be an impact of misuse of medication, whether that be intentional or accidental. Mm-hmm. Could be alcohol use, could be a medical issue going on. So you're noticing the changes in her personal hygiene and the caretaking of the home, and that would be a red flag that you'd want to bring to the buddy coordinator to address.
And the clumsiness. Yeah,
absolutely.
Yeah. So again, could be all those issues: stroke, balance problems, substance misuse. We know certain parts of that. We don't know all of them, but that's where we all work together as a team to evaluate the medical issues and the behavioral issues both. So in summary, we're thanking you for volunteering for this program, and really wanting to emphasize that what we hope for this program is to decrease the isolation of the older adult that is referred to the Buddy Project, and that we really do feel that it is probably not going to be common that you'll face any type of a crisis situation as you're volunteering, but that we do believe that information is powerful, and having resources available increases folks' comfort level and sense of confidence. This information that we share with you is just so that you can observe any red flags that may come up, that you'll feel comfortable asking about those if you notice them. And that you'll notice any changes with your buddy over time, because you'll know what they were like in past visits, and you'll be able to compare that to anything that may be a concern today. And then again, just with that last piece of encouragement of contacting the buddy coordinator so that those resources can be mobilized.
So this slide just shares some resources that are going to be important as you proceed with your volunteering. The first is Lorain County Public Health and the phone number there. If you need to get a hold of the buddy coordinator or someone involved in the Buddy Project, certainly call that number. The National Suicide Prevention Lifeline, we always like to make sure that everyone in the world has this phone number, because it's a 24/7 hotline for those who are having scary thoughts. Our local 24/7 crisis hotline is the NORD Crisis Hotline at 1-800-888-6161. Another really great resource is the Crisis Text Line, and in Ohio, one can text the word or the number 4 and the word HOPE to the number 741-741. Some individuals aren't very good with picking up the phone and are more comfortable with texting. Individuals, maybe older individuals who have difficulty with hearing, may feel much more comfortable texting than trying to get on the phone, and a person can reach out for help for depression and suicidal thoughts in that way as well. We have some contact information for veteran-specific concerns. The Navigator hotline, do you want to talk a little bit about the Navigator line?
So Christine represents the Alcohol and Drug Addictions Board for Lorain County, and then there is a counterpart to that board for mental health concerns. And what that board did is they funded this Navigator line since there are so many different organizations that they contract with, and that may differ according to the age of the individual, the type of problem, the type of assistance they're looking for. So rather than having an individual that's looking for assistance have to call all these different numbers, you can call one number and they will conference call you in with the most appropriate agency based on what you're asking for. So the idea is it would be almost kind of a one call, one-stop shop on that. Firelands is my agency, and we are a behavioral health agency, treatment agency, and we have been tasked by the mental health board to have staff available to accompany you, if your buddy will allow it, to sit down and go over any concerns, questions, and make referrals as warranted for those buddies. So that is one of the options that could occur if you call the project coordinator. Then they can pull us in and we can assess for all of the behavioral health concerns, meaning on the mental health side of things and the substance abuse and misuse side of things as well.
In terms of substance abuse resources, Firelands does an excellent job in working with substance abuse, as well as the Licata Way. We also have other agencies in our county that can provide services for substance abuse. The Addis Board of Lorain County contracts with Firelands and the Licata Way. So you see the number for Firelands there, and the Licata Way has a 24-hour helpline. That is a helpline only for addiction crisis. So if it's a mental health crisis, you're going to want to use some of the other numbers. But if you're struggling with substance use, and any time of the day or night, you can give the Licata Way's helpline a call. We wish you luck with your volunteering, and we know that you're going to have such a good time with this project. It's been fun working on it, and we've heard a lot of great stories of the fun people have had.
Thank you.